Hi everyone, my name is Sriteja and today I'm here with Dr. Reena Trivedi.
Hello, Sriteja. Thank you so much for inviting me to this channel. And it's commendable that you're using your platform to bring awareness about mental health issues.
Thank you so much, Dr. Trivedi. And I'm also here with Dr. Kalpana Nathan.
Hi, very nice to be here, and I'm excited to be on this little panel with Dr. Trivedi.
Thank you so much. The pleasure is mine. Let's get started and introduce these two doctors. So starting off with Dr. Trivedi, can you tell me what kind of doctor you are and what specialty you are involved with?
Yes, I'm a board-certified child and adolescent psychiatrist as well as a general psychiatrist.
Wow. Okay, and Dr. Nathan?
I'm also a psychiatrist, not specialized in child, but my area of expertise is forensic and addiction.
I see. That's really interesting. And for both of you, I'm going to ask both of you. So, what inspired you to pursue this medical specialty? Starting off with you.
So I've always been interested in medicine, and initially I was thinking of going into pediatrics, but I also have an interest in mental health, mental well-being, and I enjoy the holistic approach of psychiatry, including looking at the biological aspects of illness as well as the social and the psychological aspects. And so psychiatry encompasses all of that.
So it's like a comprehensive overview instead of too much into one subject. Mm-hmm. That's really interesting, Dr. Trivedi. And Dr. Nathan?
I guess I initially thought I'll go into child psychiatry, but somehow the path led me a different way, and I remained an adult psychiatrist.
Mm-hmm. So since both of you guys are psychiatrists, I think it would be fitting to ask you guys some questions about mental health and anxiety and how, teenagers like me face stress a lot, especially in the Bay Area and as we're applying to colleges. So I want to ask you guys, what are some early signs of anxiety and what can parents do to support their children in times of high stress and anxiety? We can start off with Dr. Trivedi.
So there are many warning signs, some things that might be noticeable by others, especially parents and friends, might be feeling more irritable than usual, noticing the person is more irritable than usual, being more restless or keyed up, or having difficulty staying in one place, moving around a lot. Sometimes it presents with avoidance, isolating to one's room, or isolating from speaking to friends and going out with them. The things that a teenager normally enjoys, they might not even want to do those activities, like going out to a concert or going out to a fun friend social event.
Mm-hmm.
I'm going to say probably in the Bay Area, there's so much pressure on kids. I guess there's lots of pressure around the world maybe, but more so in the Bay Area. And maybe that focus of having to achieve so much at a very young age. And I think as a society, maybe we should think about somehow changing it. I don't have the answer how we would do it. But there's a lot for young kids. And as time goes on, it seems like the stakes are even higher. That you have to do so much to... It's kind of a lot of pressure, I think, for kids.
Mm-hmm. Yeah, definitely. And the second question is, how can we develop resilience to these, to the setbacks that are caused by anxiety and stress, and what can we do?
Well, it's really important to develop healthy coping strategies to deal. So resilience, let's define it. A simple way to define it is the ability to bounce back from any type of stressor. And so developing some healthy coping strategies is really important, especially for teens. Having good parental support or role models, support from them is important so that it can help you go into healthier coping strategies instead of using unhealthy ones.
Mm-hmm. Yeah, that's really important to know, yeah. And Dr. Nathan?
I think... I agree what Dr. Trivedi said about the resilience is sort of bouncing back. Sometimes I think also a different way of thinking about resilience is if something happens and you don't, it's not so much as bouncing back to where you were, but maybe even figuring out a different pathway that you could, you could end up going in a different direction. Let's say you apply and you have these ideas, I have to do this. And sometimes it doesn't go that way. And I think that is often a difficult challenge, right? You've done so much work heading in one direction. And rather than bouncing back, and sometimes people keep trying the same way. I actually met someone who apparently tried 4 times to get into dermatology. Mm-hmm. I would never do that. I think after medical school, they tried 4 years of repeatedly looking for that one residency. My thought is, like, if it doesn't work out, then you kind of figure out something else and go wherever the path takes you. So there are 2 different ways of going. Mm-hmm. And I think there is no one right way, that you have to do things a certain way.
Mm-hmm. Yeah, so that's interesting. And like, because I know a lot of people who are also like such focused on one path, and I just know that if it doesn't go their way, then like it's going to be like really bad for them. And I think you also mentioned that like embracing change is also an important thing to like involve within yourself. So I think that's really interesting, Dr. Nathan and Dr. Trivedi. The next question I have is that there are levels to stress and anxiety, as you guys definitely know. But how do we know when to seek professional help, and when to take that extra step and like be like, okay, I need someone else to help me, a mental health professional to help me. So when should I know, and when should I take that step?
So generally, when the symptoms start to interfere with your daily functioning, daily life, your mm-hmm. ability to even go to school, go to the different classes, take the tests, ability to do everyday activities such as taking care of your hygiene, taking care of food and sleep, when those start to become unmanageable or unable to be done, it's a good time to speak to somebody. Sometimes if parents notice that something is not right, they can approach their teen. And one way is to ask the teen, are you in a mood to talk right now? Or if not, when is a good time to talk? And then sitting there and being non-judgmental on the parent's part and allowing the teen to express themselves as much as they feel comfortable. Sometimes they might not feel comfortable, and so scheduling a pediatric appointment and having them, the pediatrician, the team over there, do a screening assessment and try to figure out more what's going on. And so it's not a very straightforward answer. It depends a lot on how much the teen is willing to share and how much you're concerned enough to go to the pediatrician, or even if you're not so concerned, still I would say go, because if there's nothing to worry about, at least you know that it's been looked at.
Mm-hmm. Yeah, I think that's really important. And Dr. Nathan?
I think kind of like the well baby visits that they have, you almost have to think about mental well-being and mental health advocacy. And I would advocate everyone having some counseling sessions. That mm-hmm. I think, in the ideal world, that every human being has that. And I think early on, if we get into that, rather than wait for things to go wrong, or we get lots of, whatever the traumatic events might happen, and then we end up having a lot of anxiety or depression, and then we have to cope. So it's almost, if you were to have all the coping strategies early on and learning mm-hmm. Because things are going to go wrong at some point or another, right? In life, that's how it is. And sometimes even traumatic things can happen early in your childhood, and that is really, really difficult. But hopefully, it doesn't happen that early. And later on, if something were to go wrong, or even coming back to your school and the pressures of that, if you were able to sort of develop coping strategies. And when we talk about coping strategies, it could be very simple things like, how would I reframe my thinking? We call it cognitive behavioral therapy. It's got a fancy name, but it's really, if I were to, my thoughts, if I don't do this well, then all these other things won't happen.
Mm-hmm.
Catastrophic. We catastrophize often. So really stepping back and looking at my thoughts, and if I can reframe my thoughts in a way that can bring down my anxiety about I think Mark Twain said that 80% of the time we worry, or 90% of the time we worry about things that are never going to happen anyways. We worry, there's going to be an earthquake, or, some people, anxious people always think about the future and how they're worrying about all the terrible things that might happen. Whereas depression is you ruminate about the past. So it's an interesting thing. But the most important thing is the here and now. What do I have right now? And bring that mindfulness. That's my, if there's one thing that we can all get better at, it is mindfulness. Dr. Trivedi did a retreat, I think, recently too.
So I think focusing on the present is a big thing. Also, something that you mentioned in the beginning, like instead of knowing when you should take that extra step and consult someone else for your mental health problems, but instead just having everyone do it as part of like a routine. I think that would be really good, because then people develop stress around the stress itself. When they would know, like, should I ask someone? Should I not ask someone? So I think having regular appointments would be really good. And I think that brings me to like my next point as well. Like, what can we do? Just simple everyday things that we can do to help with our mental health and to help with our overall well-being as an effect of the mental health. And we can start with Dr. Nathan this time.
What can we do? I think if you think about lifestyle medicine, I think that what are the things. I think your mom also does lifestyle medicine, so I would say exercise is the very first thing. If you're exercising, you're sleeping okay. Sleep, you're taking care of that, and you're eating right, and you have a good support system, right? So those are sort of the basic things. Exercise, I think, can be transformative, really, whether you're young or whether you're old. Just activating your whole system, especially as you age. I think, perfusing your brain with more oxygen. All that exercise kind of helps and activates the system, I think. It doesn't have to be very difficult, but I personally think the mindfulness and being very aware, it could be with your breathing, in whatever you might do. And if we were to kind of cultivate that mindfulness in everything we do, right? My brain kind of scatters all over the place. So you might think you're very, very busy running around the house looking for your keys in the morning. You can spend half an hour. Because if you're distracted, then you're doing a lot of that. As I got distracted earlier, even in this, so my brain is easily distracted. So the mindfulness really kind of makes you really focus in on any task. So if I'm slower in the morning and I exactly know I'm aware of what I'm doing, then I'll know where my keys are, right? So although I may look more relaxed, I could be more productive with my day, rather than in the frenzy running around, before leaving for work. And I used to do that a lot before, but now at least I have a place for my keys. So there are little things that you can do to alleviate your anxiety. The stress of, just doing the everyday thing gets a bit much. So that's a meandering here and there in response to your question.
No, yeah, I think that's really a really insightful response. Yeah, I think like knowing what you're doing is really important. Like, though it's really simple, people tend to forget about it. Yeah. And Dr. Trivedi?
So our environment influences how we feel. And so, especially in the home environment, having open and honest communication with people that you live with, having communication where you feel safe and not judged, and you have the ability to express yourself, that is one of the pillars of a healthy environment. Also, having a clutter-free environment, having a clean desk, and it allows you to be able to think clearly. Having maybe lighter colors instead of darker colors, natural light, having greenery can play a profound effect on your mood, along with all the other things that are important lifestyle things like exercise, sleeping properly, eating properly, having healthy routines and habits, like a home for everything, including the keys. All of these things together can make a big difference in levels of anxiety and levels of and ways to be able to cope with stressors.
Well, yeah, definitely environment is a big factor in mental well-being. Like even like in a dark room, you would definitely feel much. I would definitely think you would feel much worse than if you had like a nice, light, well lit room. I think also like having a organized desk is also important. Like on a side note, I read an article that said that like if you have like a dirty desk, it would be better for like your creativity. Like, do you think that's real, or like what do you? If both of you have input on that.
There are different. Everybody's different and unique, right? Everybody's brain works in a different way. There is some correlation between creative types and having more clutter and mess, but it's not messy to them. It's you can call it organized clutter, and so I think that's what you're referring to.
Oh yeah, that makes much more sense. Dr. Nathan, what do you think about that?
So I've never been organized, so I think it's hard for me to kind of keep it clutter free. But it's the concept of minimalistic, ways of, if you have very little, they say before you can clear the clutter of your mind, you have to clear the clutter outside. I think your environment, and it's a hard thing to do. But I think in the Buddhist traditions, you really, it's a simplistic way, right? It's very hard to write simple things and say simple things. It's easy to give, think about big things to do, and writing also. I feel like the Buddhist writing is very simple and straightforward, but a lot of wisdom there. And I think that, and they talk a lot about cleaning and keeping your surroundings. That's sort of the tradition. So it's a hard thing to get there, I guess. But creativity doesn't. I would say, I personally have felt like medical school is not good for your creativity. I'll say that. I think too much of. I think it's not something. I personally have felt that. You're creative, you have to go back and figure out your creativity after medical school. The training really makes you kind of think about exactly the 10 symptoms you have, and this is what you have to kind of think about all these diagnostic. Medicine, it's a difficult thing to kind of pair creativity with it, I think. That is my personal view of not, of thinking, my thought process going all over the place, but
I think it also speaks to the fact that like everyone is different, so you also have to account for that as well. But hearing both of your guys' responses to all these advices about mental health is really inspiring me as well, and I learned a lot about like what I should do to improve my mental health as being like a high schooler who undergoes stress like almost every single day. So I want to now touch upon your guys' actual jobs, and I wanted to ask what are the most significant parts of your job, and what do you feel that is the most insightful and the best thing about your guys' jobs? We can start off with Dr. Trivedi.
Okay, so the first part is what's our role? What's my role every day? So I work on an adult inpatient psychiatric unit. So we see patients that are 18 and above, and they have acute mental health issues, and that's why they're inpatient. And sometimes they're there voluntarily and involuntarily. And so that produces a lot of challenges. So significant aspects are balancing, in this role of mine, balancing the importance and need for treatment, especially as we're dealing, in inpatient setting, we're dealing with big things like dangerousness, including suicide, homicide, patients that are not able to take care of their basic needs, like eating and basic things for survival. So balancing that out along with human rights, because sometimes we're keeping people against their will. And so that is a very significant thing that I always have to be mindful of and always keep in the back of my mind. The other part of my role as a psychiatrist is working with youth. So I work with young people in an outpatient setting. And so that's a whole different type of job, not only because of the age is different, but now I'm working with the outpatient setting. And so I would say the significant part of that is I would say with young people especially is communicating with the parents and making sure that we're all on the same page. Because, young people, they depend heavily on their parents for support and for everything. And so having them involved is very helpful to the youth, because the teen or the middle schooler, because they are there with them and they could help them if there's a crisis or something that needs to be done for their safety or for their emotional well-being, then they're there. Mm-hmm. Also having the middle schooler or teen work with their parent so that if they need something, then they can call on them, or they can have some support in different aspects of whatever's going on in their life.
Mm-hmm. Wow, that's so basically you have the whole age group. You have over 18, you have under 18.
Yeah.
It's a nice balance, yeah. Dr. Nathan?
Well, I guess over the course of my career, I've just done a variety of different things, worked in inpatient, outpatient, a lot of clinical. I really enjoy teaching. If I were to have one thing that I'm most passionate about, I would say teaching is over the years I've really, really enjoyed. What I'm doing now is probably the most interesting job that I've ever done, I would say. I started my residency 35 years ago, so it's over the career, I guess. So it's a place where I work in the custody setting. Custody is correctional setting. So it's a place where public health, public policy, legal issues, and healthcare in general, it all kind of comes together. So if you think about incarceration rates in the U.S., we send people to jail more than any other country in the world, which is kind of a really sad thing. And when people end up in jail, it often affects the people who are of lower socioeconomic status. When you think about structural racism, all those issues that kind of impact people. Yeah, it is. It's really sad, and then you have to get, what kind of healthcare is provided for them in that setting. So you have to kind of work with collaborative courts. So they're looking at what the charges might be. So if I have mental illness, and I ended up doing, they call them really quality of life crimes. So if I am mentally ill and I got intoxicated and I'm homeless and I wander around and enter someone's home, right? And that could be trespassing, and that I could get taken to jail. So it's kind of a sad kind of combination of things, right? So partly if I don't have a home, or substances when they interfere with my well-being. And so a lot of people disproportionately end up in jail, and they really shouldn't be going there. We have to have other places of treatment for them. But when they do get there, can we get them out sooner, or can we get sort of, there are certain courts that can get you out of there quicker and get you into treatment where you need to be. So it's multiple systems kind of coming together. So I would say that is sort of the very, very interesting part of it. I did work for the VA for a number of years, almost 24 years. Also working with veterans is, now looking back, I think it seemed, I have not done this now for some years now, like 4 or 5 years. So I do miss working in that environment also. I think you're not so aware of what's going on in your community, and that is why when I worked with Dr. Trivedi at El Camino, it's good to know what's happening in your community, how are people affected. Whereas if you're in a federal setting, you hear a lot about the global things, right? I don't think I've talked with anyone who served in the war in recent years, but that's kind of what my everyday life was, listening to people who came back from Iraq and Afghanistan wars. Or even early in my career about Vietnam War. I even had, I took care of someone who was a World War II veteran. It was kind of amazing. He was an amazing guy. So there are those kind of interesting kinds of things you see. And in your own community, what happens? So El Camino, it's a community hospital, so you really are in touch with what happens in your community. And the county, you get the more underprivileged people. So I think the underserved, and Santa Clara County does a pretty good job, I think, in looking at those issues. But again, you see, they say it's the tale of two like the Tale of Two Cities, and they say the two valleys. There's Silicon Valley, so there are the very, very wealthy, privileged people, but there are also people who are homeless and struggling, with a lot of people who live paycheck to paycheck. Housing is so expensive. So those disparities create those things. So you could also be in a place where you're taking care of a certain group of people, but as I've gotten older, it's more interesting to see what happens to that underprivileged group of people. What happens to people, right? Mm-hmm. If you, anyway, so that you can think about that structural inequalities and things that happen, social justice elements, and social determinants of health, and looking at the whole lens of a person. How did this person end up here at this time? For any number of complex things lead you to that. Mm-hmm.
So you can look at various aspects of health through what you're doing right now. That's really interesting, Dr. Nathan. Switching the lens here, what are the more challenging aspects of you, like both of your jobs? And if you want to talk about that a little, we can start with you, Dr. Trivedi.
So, challenging aspects, I would say, helping the patient understand that they have this very serious diagnosis, and having them accept treatment. A lot of times patients don't want to accept treatment because either they don't have a lot of insight into knowing that they have this illness, and sometimes they don't believe that they do, and so they might not accept treatment. So compliance is a big issue. There's a lot of other aspects too in medicine, such as dealing with insurance, dealing with hospital structures, dealing with the family, if they're willing to be supportive, or the lack thereof family support. So there's many different challenges. I would say just being a physician in general, a challenge is, you're basically working 24/7, even if, you have a 9-to-5 job, you are, because it doesn't just stop when you leave.
Yeah. Like life doesn't just stop at when you're done with your job. Yeah, that makes a lot of sense. Yeah. Dr. Nathan?
Yeah, the challenges, I would say, access to healthcare, in psychiatry, parity. When you think about mental health, often patients struggle. It's much harder to get psychiatric treatment, and it shouldn't be that way. But this is because we don't have universal care for everyone. And even if your insurance covers medical treatment, it may not cover psychiatric care. Navigating that is really, really difficult, and that is partly the reason if someone gets depressed, then you don't really have the energy or the motivation to go figure out all of this and get the help you need. I think they are thinking about even college campuses, and they're looking at the kids who might get depressed. They leave home and they go to college, and then they don't have they have to create a new group that supports them. And I think they're proactively looking at making therapy available for all college kids, not waiting till someone gets so depressed they don't go out, they don't. So I think that is a population they're looking at, and looking at many other things that they're doing. But I think it's not easy to get care, period, right? That's one of the most frustrating things. I think personally, as a psychiatrist, I would say you can do so many interesting things. So if you get tired of doing things, I think, very quickly, then you can move around. You can move around within it. Within the VA, I think moved around quite a bit. Within that, you can be there. Or if you're in the county, you can move around a lot. But it seems like the more specialized you get, you're kind of in that bucket. Whereas psychiatry is a wide range of things that you could do. You could be a general adult psychiatrist. You could dabble. You don't have to be an addiction psychiatrist to deal with substance use issues. So the challenge is, I think, to keep yourself stimulated, looking to, I think that's something. If you're a surgeon also beyond your 60, and then if your hands start, a little bit of a tremors, there's not a longevity. Mm-hmm. Whereas psychiatry is longevity. You can do it as long as you want. So I think that there are lots of different aspects about psychiatry that I didn't quite appreciate, that I've appreciated as I've gotten older. The option to move around and try different things, which I think is a little bit harder if you are in certain other specialties, or maybe not. So.
Another question that I have about something that is really involved with mental health is electronics. So I just wanted to ask, what is the role of electronics in mental health? And if you want to talk a little bit about that, we can start with Dr. Nathan.
I think there's a whole area with addiction. When we think about substances, there's also screen addiction. So there's a whole area that's developed when people are so tied to their phones or any other games or whatever that they may be doing that it interferes with their life. Just as a substance can, it becomes an addiction. Having said that, I think especially for the young people, I think spending a lot of time on the phone may not be the best thing. You want to socialize, you want to engage with people. There's also the positive. Again, there's negative and positive to everything. The positive is that, even if you think about social media, I want to say that could be a helpful element to that as well, because the younger people, often many of them want to communicate that way. And even if you think about, there's some with the pandemic, when we went into the Zoom ways of, therapy sessions were done that way. In some groups, kids who struggle with autism, they, or in that autism spectrum disorder, which Dr. Trivedi can speak more about, they liked that engagement because I think coming into a group setting with a lot of people, it's overwhelming. So for some people, they did actually better in learning. So that the data came out after the pandemic. So there's pros and cons to everything. But of course, here in the Silicon Valley, where we all have these electronic gadgets, limiting that would be better. But if you look at some of the poorer countries in the world, a lot of education resources can come that way. So it's a balancing act, I would say.
Mm-hmm. Yeah, I would agree with what Dr. Nathan's saying about the balance. Everything in moderation, including sleep, eating, exercise, and electronics use. We were speaking about anxiety before, and one of the warning signs we talked about is withdrawing and isolating. A lot of times young people, they overindulge in online activities, including social media use, and sometimes that can be dangerous for them, especially because they're going through something and then they start going on to social media and comparing their lives to others, and it can worsen the depression and anxiety, actually. And so it is important to limit the use and to be very mindful about that. It's hard for that young person to do it sometimes because they're feeling so bad. This is one thing that the addiction pathway starts to get lit up, and so it becomes something, I think the term you guys use is doom scrolling. Mm-hmm. So people just keep on going on and on without stopping. And so I think it's really important to be very mindful and very proactive on the parents' part or the caregiver's part to put some limits and restrictions. And I know people don't necessarily like to hear that, but once the symptoms are more controlled, then getting rid of those controls would be a better idea for the person's well-being.
Mm-hmm.
I guess the one other thing I would add is insomnia. I think when they looked at the teenage, I think we had that the cluster of suicides that happened some time ago in the Bay Area for the high school kids. The one element they found was insomnia, that the kids who didn't sleep very well over the night, and if using the electronics often keeps you off the light, the blue light and all of that. And hence, I think the change to taking away the zero period, and I think they moved it so they could, they stay up late and then they get up early to go for class. So electronics did play a role in that insomnia, I think. So that's the only thing that it ever came out. In addition to addiction, how well you are sleeping gets affected, I think. Mm-hmm. If you have the light in your eyes.
Oh yeah, super insightful. My last question to both of you is that I know a lot of my viewers and me myself are also considering a career in medicine, but don't really know what life as a doctor looks like. Mm-hmm. And I just wanted to ask you both, what is the biggest piece of advice that you would give to someone like me who's in high school who wants to go into medicine but doesn't really know much about it? Mm-hmm. What is the biggest piece of advice that you would give to them? And we can start with you, Dr. Trivedi.
Okay, so to a high schooler, the biggest advice would be think about the future and think about how you might want your future to look. And so what I'm talking about is the work-life balance that we hear so much about. And so if you're going to be choosing a career in medicine in general, be prepared to not make it just a 9-to-5 job. That's not always possible because crises and emergencies can happen. And so the work-life balance means which kind of specialty would you want to go into? Pediatrics versus surgery, two different lifestyles. And so looking at that is very important. The other thing I would say for advice is it's really important to be comfortable sitting with your patient and spending time and being curious and open-ended and non-judgmental and developing a good rapport and learning about the case from the patient. I think that's really important, being a good listener. Mm-hmm. And besides that, it depends on the interest of the high schooler. What are they interested in? Are they interested in a particular, are they interested in STEM? Are they interested in something else? And what part of medicine would they might be interested in? That kind of stuff is also important. However, it's not set in stone. So if you are interested in something or you don't know what you're interested in, that will evolve and change as you go. I actually wanted to be a surgeon when I first applied to medical school, and I'm a psychiatrist. So, things can change. And so keeping an open mind yourself and just kind of going through everything and kind of figuring it out as you go, as you have different experiences is what I would say. So not pigeonholing yourself into one thing. I'm only going to do this and this or bust. I think that is not a good idea.
Mm-hmm. Yeah, that makes a lot of sense, Dr. Trivedi. And Dr. Nathan?
It's hard to find out what it is that you're really going to be happy doing, I think. And early on, sort of really paying attention, not because someone said this or, what is something that makes you feel energized and really happy. An example would be just because everyone says you have to know, classical music. You don't, if it doesn't give you joy, kind of stuff, you have to kind of experiment with a lot of things. So first just kind of figuring out this is what you want to do because there's many years of schooling and lots of things ahead of you. And then once you get into medical school, I would agree, people come in saying this is what I'm going to do and they change quite a bit. The hard part is you have to do rotations early in your clinical, third year, and you have to be applying. So most people may not choose to do something much later rotation, which you have to fulfill so many, clerkships. And that is always, so you try to do something early on, which you have an interest in, and then you find out this is not what really is something that you are passionate about, and then you may find something later. I think exploring, taking the time to explore what really makes you kind of happy and energized and finding that. And that may not be really what others expect of you or what the world expects. And, finding that for yourself, I think is an important thing. And that's true. A lot of surgeons leave surgery and come to psychiatry, even after first or second, I've had people. I don't think any psychiatrist, it will be an impossible task to get in that way later. Mm-hmm. But they drop, they decide, this is not for me, and then they move into psychiatry. Mm-hmm. It's an interesting kind of a shift all the way from, one end of, coming into, I think I knew someone who left surgery, came into psychiatry, and then left medicine altogether and went into acting.
Oh, wow.
Very difficult to do that, I think, later in life, because you already put so much effort here. But I kind of, it's amazing. Now they say there are the thirds, right? The first third and the second third and the last third, I guess. What are you going to do? So as we end up living longer and longer, it's almost, what did you do in the second third of your life? The last third could still be very, very productive if you're thinking about, again, I'm not going to be saying want to live till 90, but how productive, and as we are thinking about it, you can recreate a whole another career for you, I think. Yeah, and maybe if you're lucky, you can get to do 3.
Yeah, so if you think it's too late to change it, it might not be too late to change.
No,
So
it never
that's
is
really
too late,
interesting.
yeah.
Yeah. Another question I have is what is the number one thing that you both love in psychiatry? And if you want to talk about that a little bit more, we can start with Dr. Nathan.
I guess a little bit what I said before, that it gives such a variety of all the different things that you can do. Psychiatry was probably, when I went into psychiatry, it was sort of not the most sought after residency. But now, I think in 2017, it was the second most sought after residency after plastic surgery. Mm-hmm. So even pre-pandemic, I think there was a greater interest. And I think with the younger people getting more interested in lifestyle, the balance, work-life balance, and in general wanting to, maybe know yourself better in a way. I think all 4 years of your residency, you're doing a lot of that. I think, it's even pre-pandemic. And since the pandemic, I think it has gotten to be a very sought-after residency, mm-hmm. which was not the case when I started out. I think when I said I wanted to go into psychiatry, my mother, who's a physician, said, couldn't you be an anatomy professor? How come you want to? Why psychiatry of all things? So it's kind of interesting. So it wasn't sort of it wasn't something that people thought of very much. Or what would you do as a psychiatrist? And that's kind of completely changed in the last 3 decades, I would say, that most people are interested. And I think neuroscience has kind of taken off a lot. There are lots of new interventions that people are doing. It's become very different from where it was before. Mm-hmm. And I think, the only other thing I would say is the stigma about mental health. I think that too, around the world, you do see a little bit of that, or even in certain settings, you see that a little bit more. And as that has gone away, I think the parity, when you think about parities, mental health and your rest of medicine, everything kind of has come together, so which is kind of nice, and it's in a different place where it was 30 years ago, I would say.
Yeah. So you like the overall synthesis of psychiatry, and you like because there's recent innovations and advancements made it really sought after specialty.
For the young people watching, I would say this is the thing you should choose.
And Dr. Trivedi?
So being a psychiatrist in general requires a lot of dedication and a strong educational background. That being said, the profession aligns with my personal interest in and my passion in making a positive impact on people's lives. And so I think that is the biggest reason I would say that I wanted to become a psychiatrist, and if other people feel that way, then they should consider this field.
I'm sure a lot of people don't know the difference between psychiatry and psychology. So, Dr. Trivedi, do you want to explain the difference between them? And we can come to Dr. Nathan after.
So they sound very similar. And so a lot of times it is confused, even by our physician colleagues. And so just the iatrist and the ologist are the difference. So a psychiatrist, which is what we are, we're medical doctors, and so we've gone through the whole, 4 years of medical school, as well as done a residency, except we've done the residency in psychiatry. Whereas another physician, maybe an internist, would do a residency in internal medicine, or a pediatrician would do a residency in pediatrics. And so after those 4 years of medical school, we would do that training in our specialty. That is what a psychiatrist is. A psychologist is a mental health professional. However, their trajectory and the schooling that they do is different. And I'm not qualified to speak on that, so I'm gonna stop here.
Mm-hmm. Is there anything that you wanted to add, Dr. Nathan?
Yeah, that's kind of the real difference. And I think you could have a variety of different people who do a therapy. So you can see, master's level trained clinicians, mental health clinicians, we call them. And if you have a PhD, you've done more schooling than someone with that, So there are a variety of different things. And I think in psychiatry, the other nice thing is it's a very multidisciplinary approach. What that means is, when we see people, we work together as a team. So there might be psychologists, there'll be social workers, and, psychiatrists, and then a lot of trainees that kind of work together. So if you think about it, you're not just treating the person or their mind, you're also looking at what's happening with their families. So social workers, for example, look at the whole structure, socially, the families, and they go to school and think about it in a very different way. And I think that social perspective sometimes in medical school kind of gets lost. It's coming, when I mentioned social determinants of health, a lot of the things, those lenses, I don't think, sadly, in medical school, we didn't kind of think about those things. And now that's kind of shifting. So there's lots of social justice issues, the structural racism or discrimination, and how people have thought about it. So, for example, in medical school, I think when you think about all the systems have to come together, even the physician has to think about all those systems. So if you're managing diabetes and your patient comes to you and they haven't taken their medications, it's, in the olden days, people would say the patient has been non-compliant, the blood sugars are, So now we think about it, you have to kind of think about that, could that patient make the $30 copay, or do they have to take 3 buses to get to the clinic, and hence they didn't follow? What were the challenges? You're made to not just focus on, your diabetes, your HbA1c, the test we do to see if your diabetes are under control, just not that, but you're looking at the whole person. And all the other issues. And so you yourself, is very difficult to address it. So I think in psychiatry, we've always thought about beyond the person, what are the other issues that are happening? And I think, with psychologists and social workers, or, lots of other people who are part of that. Recreational therapists, occupational therapists, we work with occupational therapists. They do amazing things. Yeah. So everyone brings so many different skills. So that part of it is, you see that more in psychiatry than anything else. I would say any other part of medicine, which is a nice approach as well.
That's it for this interview, guys. Thank you so much, Dr. Trivedi and Dr. Nathan, for this wonderful interview. I learned a lot, and I'm sure the viewers have learned a lot too. Comment down below the biggest thing that you've learned, and feel free to like and subscribe. Thank you. Bye.
Bye.
Bye.